The birth process, it's often a baby's first physical and neurological stressor, even in normal deliveries. Pediatric, prenatal, and family chiropractor Dr. Savy joins us now to describe what birth does to your baby's nervous system. Dr. Ford, thank you so much for being here.
Thank you so much for having me.
I think that's something we don't often even consider. There's so much else that's going on during birth. We don't actually think how it affects a baby.
Yeah, in fact, you know, when I'm talking to parents, a lot of times they don't even realize this, but even in a natural vaginal birth, right, there is a lot of stress and strain being applied to the upper cervical area. And it's not just always a gentle glide, it's many times a pull and twist type movement on this upper neck area. Now, with a C-section delivery, forceps, vacuum extraction, it's even more additional rotational stress and force being applied in that area.
You know, there's so much going on with the mom that we're not even considering all the twisting and pulling and everything that's going on with the baby. And I think in my own head, I always think, well, their skeleton's soft. They're okay to do that. They're more adaptable. Is that right?
So, I mean, there is definitely a pliability to it. However, what happens a lot of times is we see that misalignment, that restriction, and that tension being held in that upper cervical area. And that is so crucial because that's controlling sleep, digestion, relaxation, growth and development, immune function, right? What are babies supposed to do? Eat, sleep, grow, be healthy, all of those things, right? So we want that clear communication from the brain, down the spinal cord, out the spinal nerves, because that's literally controlling and coordinating every function in our body.
Interesting. I like being wrong because that means that's that opportunity to learn and change the way that we view things. And then so often that makes us think of everything that it happens as a result of that.
Yes.
So are these effects immediate to a baby? Is there a way to maybe soften what's going on there, or do we have to correct it after the fact?
So, like any kind of thing, the earlier that we can catch this, the better off that we are. 80% of brain and nervous system development happens in those first few years of life. So that's the best time to make sure that's actually functioning correctly.
So what can we do?
Well, pediatric chiropractic care is great. I see that about 95% of kiddos after the birth process have that misalignment that's creating that neurological stress. And with gentle adjustments, it's usually just a fingertip contact. It's not what most people would associate with an adult adjustment. There's no popping, cracking, anything like that. But we're able to restore that normal communication and really help to regulate that nervous system.
I'm glad you say that because especially now, for some reason, it's in my algorithm on social media. I have all the chiropractic cracks and pops and everything that's going on in there. And that seems like that would be a little aggressive for such a tiny child.
It would definitely be very aggressive, but a pediatric neurologically focused chiropractor is not going to apply that type of stress. We do a appropriate amount. It's usually using about the same pressure that you would use to see if a tomato is ripe.
And what are you doing while you're doing those adjustments?
So we are really taking tension off of those areas to restore that normal communication from the brain to the rest of the body.
Is any age too young? Is there a certain guideline?
No, not at all. In fact, I checked both of my children right after birth, literally before they even got on the breast.
And then I bet they get used to it and they kind of soften as somebody touches and you're doing the right things.
Yeah, absolutely. I mean, you know, we see kids just kind of relax into the adjustments. In fact, a lot of times babies fall asleep while they're getting adjusted because it is so gentle.
Now, what kind of results are you seeing, especially like with your own? You started as soon as they were born.
Yeah, absolutely. Well, when we have that subluxation or that neurological stress from early ages, a lot of times we can see any kind of nursing or latching issues. We might see colic, we might see reflux, constipation issues, sleeping issues. But when we can address that and really get our parasympathetic nervous system back online, you're able to see babies that are calm, that they're relaxed, that they're able to latch appropriately, they're able to go to the bathroom on their own.
It makes so much sense because you're getting to the actual root of the cause cause instead of just treating the symptoms, especially in a child that young, where you probably don't want to be pumping them with a bunch of medicine, especially if that's not even the issue.
Right, absolutely. Whenever we see those signs, it's always signs that there is some sort of neurological stress where a baby's not adapting like they should.
It makes sense. They can't exactly tell us what's going on. And even as adults, we can't usually put words into where the pain is coming from and what's happening and what's going on inside. So it does make sense. It's really, really interesting. Now, we're going to continue this conversation with kids in chiropractic care, but thank you so much for this. Definitely opening up a lot of eyes for sure. Appreciate you.
Thank you so much.
You can find all this info on our website, bloomtampabay.com, and stick with us because Dr. Ford is back with us after the break. We'll be right back.